Okay, but so that's the second point. So nasal breathing, good. Mouth breathing, bad for craniofacial development. Food to do that.
Eat tough food is, if you don't have a sufficiently tough diet, I guess you could replace it. But explain to me the mechanics of how the difference in whether you breathe through your nose or breathe through your mouth changes the shape of your face and head.
Yeah, well, and it goes beyond that. If you breathe through your mouth as opposed to your nose, first of all, you bring in less oxygen than you would if. So you're effectively putting yourself into a state of apnea, right? Which is bad during sleep. And guess what? It's bad during waking states also. You're getting less oxygen to your brain, bad. The sinuses, we hear my sinuses are clogged, or the sinuses, wish I had brought a skull with me, because one of the most impressive things about a skull, human skull being no exception, is that the sinuses are literally these little tubes or channels through which fluid and air can move. And the sinuses, even though they are essentially created by the fissures between different bones, so like there's two or three different bones that are interdigitated and create these tunnels, they're actually fairly plastic in the sense that they can be modified in terms of their shape. And so people will say, well, I have a deviated septum. Guess what? You should try and emphasize breathing through both nostrils in order to undeviate your septum. Now, if someone has a broken nose or something that's really structurally abnormal, they may need corrective surgery, but purely through deliberate nasal breathing. So it could be mouth taping at night, but also just deliberately nasal breathing during most of your cardiovascular training, unless you need to really, hit the gas, in which case